Hello, everyone. Thanks so much for joining us. My name is Solome Tibabu, and I'm your host for Going Digital Behavioral Health Tech. And I'm so pleased to have José Aponte, the Vice President of Product Innovation at Beacon, joining us today. Jose, please tell us a little bit about yourself and how you got into this space and what exactly you do as the Vice President of Product Innovation at Beacon.
Yeah, definitely. Thank you, Solomon. So let me start a little bit of how I got into this and a little bit of background, right? And as a matter of fact, I just had my 2-year anniversary at Beacon last week, which is good, right? Because now I can reflect on everything that I've done in my past few years and be accountable for that. My background is in digital health strategy, right? So I did a lot of consulting with a small boutique consultancy here in Boston, with a lot of stakeholders, right? So payer, providers, a lot of work in pharma and life sciences and medtech. And I started around 7 years ago in that space. And I had a consulting background from a technical perspective. I started looking for a new role and I love the digital health landscape, right? And the impact that I could do. And it was really a telling when I reached out to my network where I was looking for a space that I can truly have that impact in, and I had a personal interest, right? We're all affected by mental and behavioral health. It's a personal interest of mine. I've seen it. My wife's brother died of suicide a while back, and I've seen mental health and the importance of it. And I took a role at Beacon because Beacon's mission and value really align with what I was looking for, right? That's the main thing. Their clinical expertise, the right approach and human centricity that they bring into delivering care and behavioral really attracted me to this. And we were forming a smaller but mighty digital or product innovation team and strategy team. So a great team that I felt like had the same values of how I like to work with. Let me go back a little bit to what I do on my day today. 3 focus areas, right? So if you think about it, my team and I are in charge of creation of new digital experiences for different stakeholders. We've been very focused recently on the employer side and the space, specifically on EAP, right? So how do we bring a new digital experience, a digital first front door to the EAP business? And we've been doing that for around a year and a half with great success. There are a lot more that we want to do in optimization of the experience and looking at other models like step care models, right? But we're also looking to expand later this year and into next year into other populations and what else product lines. And we're looking to expand to other stakeholders, right? If you think about a digital strategy, it can't just only be about a digital experience for the members, right? It has to be a whole ecosystem of all the different stakeholders or humans involved in delivery of care. So providers, internal associates, and others. The second bucket, which I reflected to, and I haven't been as successful in, it's really bringing what I would say innovation into Beacon. And when I say that, it's that my background is in human-centered design and lean product management. So how do we bring some of that agility and some of that empathy into some of the processes that we develop at Beacon? And not only that, but how do we deliver care at the end of the day? And I'm not going to say that we haven't been successful. It's just I come from a smaller startup, right? So as you come to a bigger company, it's a different mindset and the pace is different, completely different. So we've been successful in small pockets, and we continue to work there. And the last one, which is really interesting, right? It's the curation and looking at the ecosystem of behavioral tech companies out there. And when I say that, it's not necessarily all the point solutions, but also capabilities to deliver on that mission of digital first or virtual first. And in that, we have been partnering across a couple of different functions at Beacon, where we look at the ecosystem, partner with different vendors, and bring in value and impact from a clinical business and outcome side to our members and our partners.
Wow, that's super exciting. You've alluded to this a couple times, other stakeholders and partnering with them. Can you talk a little bit more about how does Beacon actually partner with other health plans, providers, maybe even consumers, any other stakeholders on novel behavioral health innovations?
Yeah, yeah, definitely. So let me go back a little bit to human centricity, right? Health plans are clients of ours, right? And and we do partner with them. We lean on them to come up with innovation in clinical models, innovation from a technical perspective and digital perspective. And we also look at other stakeholders, as you mentioned, providers, consumers, and we really go back to them to figure out what are their unmet needs and opportunities where we can deliver on. I did mention EAP and the product we call Beacon Wellbeing. And we did go back to the member, right? And we interviewed in primary research, did around 40 interviews for the very first research and really trying to understand what they're feeling, how they're coming into our services, and how they're trying to interact with us. We do the same with providers, and hopefully we're going to talk a little bit about COVID-19 and some of the impact there. But you know, even yesterday, I partner a lot with the provider quality management team. We did a survey, and we also do primary research with some of our providers. And at the end of the day, is trying to figure out how can we meet the unmet needs of those populations or stakeholders through service assigned and or digital interventions. One of the things in terms of health plans, I'll say clients overall. We do have certain groups like councils, advisory groups, where we also figure out, you know, where we're at and try to get feedback at the end of the day for innovation in behavioral health tech.
Hmm. Well, since you mentioned COVID-19, I have to ask,
Yeah.
how has COVID-19 impacted Beacon's delivery of behavioral health services?
Great question. We're still feeling the impact, right? I think it's been a exciting for my part, being in health tech and digital health, because now it really accelerated the adoption and the attitudes towards how we can deliver better behavioral healthcare through digital. A couple of things here, right? So from a organizational standpoint, like any other organization out there, we had to really quickly go to almost fully remote workforce in a very short period of time, right? So from an internal operation perspective, it really tested the resiliency and agility of the organization and looking at those contingency plans and business continuity plans. And what I would say, I was very surprised with the powerful response and such a quick response from all my partners at the organization. And we were able to basically move everyone remotely within a couple of days. It is good though that the Anthem deal also closed right before that time. So we had a vast support system and resources to lean upon, right? So we weren't doing this as our own, and we think that Beacon is pretty big, right? We're from my perspective, we're a big organization, but then Anthem brings such a powerful response to, and we were able to collaborate back and forth, and it really helped us. From an external perspective, right, we had to really quickly adapt to provide that continuity of care for our members, and we did a couple of things. One of them was we stood up a COVID-19 virtual health or telehealth worker. You know, we try to look at it from an operational perspective, policy and regulatory, right? Everything was changing almost at a daily pace. And also, how do we best engage with our members and providers, right? And also clients. But what we wanted to make sure is that we were providing or offering our providers the support that they needed as they move more into virtual care. And everything from doing webinars, we had a great webinar that we did on telehealth basics 101, right? It was very well attended. Around 3,000 providers attended, which is really surprising. We had great feedback from that. And then our provider team just kept going with a webinar series it's up on our website. And it's been great. Everything from how do you do crisis management to moving or translating IOP, PHP, specialty services into telehealth in a virtual world. We also did a lot of communication with providers, right? At the very beginning, I'm not going to say that we were slow to respond. It's just everything was changing so much. So we try to communicate as much as possible with those providers and really kept them abreast of all the regulatory changes that were going on. And what we communicated was, look, we're here to provide that continuity of care for our members. Whatever we can do, we will do it. And that was the message. And we kept them abreast of all the information. We kept abreast of all the information to our members. We reached out to our members, made them, we informed them of the availability of these services. And we continue to do that, right? I think this has been a great push for telehealth, for virtual health as a whole. And we want to expand on that and make it a sustainable system for our providers. And one other thing that I do want to mention, we did partner with My Strength to bring a digital solution for our members, right? So COVID resources on a CCBT level as well, which has had great uptake from our membership.
Awesome. Interesting. Yeah, speaking of virtual health, we've got a lot of virtual health startups in the audience and organizations that want to partner with them. And, given your background, being in an agile startup situation prior to and now mirroring that with leading innovation at Beacon, I have a couple more questions around this topic around how can startups understand what are some key priority areas for which you're interested in sourcing new innovation specifically, and how they go about partnering with you. And so let's start there. Like, any specific areas that you're interested in sourcing?
Yeah, so we have, we're looking at your typical, what I would say outpatient, right? Digital solutions. And a range there, we're really looking at digital interventions and the expansion of access. How do we expand access and provide the right level of care for our members? And in there, we are exploring step care models, and we're looking at some, how do we go to market with that? But we're also just trying to accelerate digital innovation and digital interventions all throughout. And we see it in a couple of different ways, right? You have your digital therapeutics, and again, it can go from what I'll say, broad conditions, right, versus something that's a little bit more condition specific. So in that sense, we're looking at everything. We're looking at what becomes, what makes sense from a business perspective, what makes sense from the unmet needs from our providers, as well as from the members. If you think about the other bucket that we're looking at, access extenders, we're really looking at telehealth. And I'll just say telehealth as a whole. In my mind, there's been a great transition of telehealth, which is, typically it was just seen as another modality of audio and video synchronous, right? Yes, we're looking to partner with more partners on the digital and virtual space that are condition specific. And we're looking at some of them like RIA, Tempest, right? And some other ones that are a little bit broader, but bring in some of those digital therapeutics like Maru. And then we're starting to look at other modalities, right? You start looking at modalities which go beyond just your typical video and audio. And that's where you start going into chat-based therapy, even some peers and group coaching and group therapy. And then the really interesting part for me, which is, it's what I'm going to talk about, and I guess it's a passion of mine too. We're a little bit farther away at Beacon from that, but it's a redefinition of access in terms of populations, right? If you look at populations in need and health equity, right? A lot of the work that Ayana Henry Health are doing in the space, that is really interesting to me. The redefinition of access, right? Access used to be a volume of providers in a specific area. That's not the case anymore. Then now we're looking at access as a time to appointment, right? Are you getting the appointment in a timely manner? But I think we have to go a little bit further beyond that, which is that the right person for you based on your situation and your reality, your context, right? And all of the different layers that you as a person bring into that therapy session and behavioral. And that to me is where we have to push this, right? And this is not necessarily, I would say, digital or health tech, right? I think there is a solution there to get smarter around algorithms and AI and making sure that we have robust sets of data to make that happen. But also it's just, how are we, going back to the design perspective of this, how do we create empathetic and compassionate experiences from a digital standpoint that do look at those, right? And that to me is really interesting. That's really where we're looking to source some of the new innovation at Beacon. Hopefully that answered the question. It's a little bit all over the place right now. We are starting some initiatives where we're starting to look at the ecosystem and really look at what are the needs from our other populations. And I didn't mention this. The other thing too is that I'm really interested in the Medicaid population and some of the other populations of need that sometimes the more consumer-oriented digital solutions haven't had any outcomes around that, right? So that's the other place where, if you're a digital solution out there that have been looking at the consumer space or the self-insured employer space, let's talk, right? Let's see how those models can translate potentially to a Medicaid or Medicare population.
Oh, I couldn't be more thrilled about so many of those topic areas. So much opportunity, and certainly in light of all that's happened in 2020, certainly has exacerbated the opportunity for all innovators, all stakeholders in this space to really make an impact. So that's fabulous to hear. More practically speaking, do you have any advice for startups in the audience for, like, how do you go knock on the door of Beacon and even get started?
That's an awesome question. Knock on our door, right? I'm always available. I myself, and I will help. I am passionate about this space. I will help navigate some of those opportunities within Beacon and Anthem and DBG as well, right? Now that we're part of that, because there is a lot of potential of that integration between physical and mental, which I shouldn't even say that, right? In my mind, it's just health at the end of the day, right? So, but it does offer us the opportunity to go just beyond Beacon. So I think it's an easy and a cliche one, but we're always open to new suggestions, and we'll navigate through, and it may not be the right time, right? And what we're doing with our Anthem partners too is that we're trying to make sure that it's the right time and keep tabs on what's going on as some of the companies mature, and just be open, right? Be open of where you are in your process and what you're looking for. And let's figure out if there's a space for us to do an opportunity. If you're looking to gather more data and prove out the model and you don't have outcomes yet, let's talk about that too. There may be an opportunity. Or if you're a little bit more mature in terms of the outcomes and you've shown business impact and clinical impact, let's talk about that too, right? There's a lot that we can do in this space. A lot of the companies that are part of the conference we've engaged with already, and as recently as a couple of weeks ago, right, we've contracted with a couple of them. I do not want to mention the names yet, but we keep looking at that, and I think for us it's just reach out, make sure that we understand your model, make sure that we understand the clinical and business model, right? And then we'll point you in the right direction. Sometimes it's not me, sometimes it goes through the network side, right? But I'll keep tabs on it and try to accelerate it and kind of be a shepherd of digital throughout that. And also sometimes we're going to face some hurdles and challenges, right? So we need to get on the phone, and I'll be as open as possible and talk a little bit about the opportunities, give some feedback, right? This is a learning experience for both sides in my mind.
Yeah, well, that's super helpful. I'm sure I'll speak for the companies in the audience. And you just mentioned challenges in terms of not even just startups and Beacon, but more broadly in behavioral health. Do you have any thoughts around just challenges and opportunities in behavioral health innovation in general to allow us to advance?
Yeah, I mean, regulatory, right? That's a big opportunity where I'm very curious to see the impact of COVID. Um, it's very hard to take away stuff. Let me put it that way, right? Once CMS has done the waivers in the regulatory aspect, it's going to be very hard for them to take it back. So I'm excited for the future there, right? I think, I mean, one of the positives, right? I'm always an optimist and trying to look at the positive and trying to spin it. Of the positives here is that we were given a accelerator, right? It was just fuel to the fire and saying, look, here's this thing, we have to move in, and it was necessary to move to more of a technology driven access of behavioral care. So that's where my mind is right now in terms of what are some of the challenges and opportunities there. And Beacon is doing some of that, right? We, through some of the partner organizations and some of the organizations that we're part of, we're trying to advocate for our providers or our members. We're trying to be an advocate. That's one of our tenets of value that we bring into behavioral, right? It's not only clinical, but it's the advocacy part of this. The other big piece that I see, and I mentioned it already, is access, right? We have the ability to, as a industry, to redefine what access is, right? I don't think we're over stigma, right? Stigma is still going to be there. That's something that we still have to do as an industry to work towards making sure that we keep at it. But I also feel like we have to really work in conjunction to work on that redefinition of access. What does access mean in terms of a human getting access to behavioral services, right? And that's where health equity comes into play, and the different special populations. Those two, to me, are big challenges and opportunities. I'll mention one more thing in terms of challenges. As always, right? I think this is a little bit of a dance, right? Digital health companies work at a different pace than some of the health plans out there, and the payers and the managed healthcare organizations, right? So I think it's also trying to get into that rhythm and make sure that we're all in it for the right thing, and just keep at it. At the end of the day, we're always going to face challenges in terms of where we're at in the spectrum of how fast we work, but let's keep at it and trying to make the best for our partners and providers.
Yes, I like that a lot. And I mean, I've got plenty more questions here, but I know that time is already up, which just flows by so quickly every time we talk. So thank you so much, Jose. This was spectacularly helpful, and really appreciate the work that you're doing, and excited to see what's ahead with your partnership with Anthem and beyond.
Awesome. Thank you, Salome. I appreciate the opportunity.